A few years ago, I was called to the emergency room to see a burns patient. The minute I stepped into the ER, I could get a strong smell of mint, and I see a man fully covered in paste. Upon asking, the bystander said on how the patient was lucky that he was around and could apply toothpaste to save his life literally. And he was very confident what he's done is right. This happened year after year. Every other burn patient who presents to us comes covered either in tea leaves, batter, flour, you name it. But toothpaste always top the list. So when such patients get discharged, I always tell them and their bystanders, all that you have to do as first aid is just show the burnt area in cold running water, normal tap water, for 15 to 20 minutes. And that will help in reducing the intensity of the burn. And I keep telling them, please pass on this message at least to one friend or a relative so that the message gets carried forward. But then it's like adding a few drops of water to the ocean. So I made a request to our hospital management if we could do it on a larger scale. The management was quick to come out with the decision, gave me the green signal, gave me all support and encouragement to go ahead with the project. And thus, Project Firefly was born. Today, as we all know, is National Burns Prevention Day. And that is why we decided to launch this project today itself. This project will start today and go for 1 year. In the first phase, we will go to schools where we will give lectures to the students and teachers as to what you should do when you sustain a burn, and more importantly, what you should not do when you sustain a burn, and when you should go take medical help. After this, there will be interactive sessions where the students and teachers can ask us and clear their doubts regarding burns. The idea is to pass on to the students the future how you should deal with burns, so that when they come to our hospitals, at least we know that part of the work is done. We will also provide a poster. That poster will have in brief what should be done and what should not be done during a burn, and the school can use that as an educational aid to teach students in the future also. This program we plan to continue till end of December. This year, this will be the stage 1 of this program. We will be primarily concentrating on schools. Maybe later on we'll go to residents associations, NGOs also to extend this as time comes. In India, it is estimated that approximately 1 million people go to hospital with burns each year, and 10% of every road traffic accident ends up in burns. This is the intensity of burns in India. However, we only have very few hospitals, actually only a handful of hospitals which have dedicated burn care units. We all know burn care is all about teamwork. It's not just a single doctor who treats. It's a team of doctors, nurses, the emergency rooms, theaters, blood bank, labs, physiotherapy. The list is huge. When a patient is admitted with burns, still he is discharged, he is treated by a lot of people. Now, what we do here is called, as Padmamar sir said, it's a comprehensive burn care. That is, the care starts when the patient presents in the acute stage, that is, in the emergency room. We divide it into 3 stages. Stage 1, the patient is stabilized in the emergency room. Stage 2, all the major burns go to the multidisciplinary ICU. We are very lucky that we have a negative pressure room there, because of which we are able to control infections effectively. And we all know infection is the biggest enemy in the treatment of burns. Those patients who are having minor burns or those who have stabilized in the ICU are shifted down to our newly opened up CBCU, that is Comprehensive Burn Care Room. In that room, we also have facility for central suction, oxygen, monitors to monitor the patient, and in cases where more intense nursing is needed, we provide one-to-one nursing also. The advantage of keeping a room is that the patient feels little more at home, because they can see their relatives a little more closely, and it is a room basically. Now, this concept of comprehensive burn care is what we've been practicing over the years, and now we have almost treated patients of all age groups, major and minor burns, with very good results. The aim of this project Firefly itself is as a first step to how improving the burn care in our hospital. So at least we know when patients come around, we know they have done this first part clearly, so it becomes easier for us to do the second part and go ahead with the treatment. Now, stage 3 of this comprehensive burn care is rehabilitation, which is very important. And both mental and physical rehabilitation has to be carried out.